Hi, my name's Lori Beagle, and today I'm going to discuss quality of life at the end of life. I decided to do my research topic on hospice care in the U.S. I picked this topic because this is the field of nursing that I want to practice when I graduate. Despite the advantages of hospice care for terminally ill patients, only a fraction of patients and families utilize these services. There continues to be a culture of intensive care hospitalization for end of life in terminally ill patients. It has been proven through various studies that quality of life and extension of life is improved with hospice and palliative care. According to Feinstone and Enderwise, approximately 20 to 25% of people who die in the U.S. utilize hospice services. According to Lynch, Dallin, and Coakley, the goal of palliative care is to prevent and relieve suffering and to support the best possible quality of life for patients and their families, regardless of the stage of the disease or the need for other therapies. My research question is, why are more terminally ill patients dying in hospital intensive care units instead of in hospice care facilities or hospice home health care? During my research, I analyzed several articles on why more patients don't utilize hospice services and how we as nurses can change that. The first article I researched is called Courage, Leadership, and End-of-Life Care, When Courage Counts. The author of the article, Carleen Kerfoot, stresses the importance of nurses to implement evidence about end-of-life care within our healthcare practices. She advocates for nurses to take a leadership role in educating patients about their healthcare options at end of life. She also advocates for reducing healthcare costs by educating patients on the importance of having advance directives in place so patients' end-of-life wishes are known. Kerfoot makes an insightful analogy when she states, "We have elegant birthing rooms, but do not have a beautiful special place for patients and families to celebrate the passing." Overall, Kerfoot makes some good points in her article. Nurses must be the patient's advocate for end-of-life care. They should provide the best care for their patients and their families. There needs to be a healthy work environment for nurses when dealing with terminal patients. Nurses need to develop systems that implement end-of-life care through evidence-based practice. The second article I researched is called Death and Dying in the U.S., The Barriers to the Benefits of Palliative and Hospice Care. The authors of this article, Feinstone and Enderwise, describe some of the barriers to hospice care in the U.S. Hospice benefits were approved for Medicare reimbursement in 1982. In order to qualify for hospice reimbursement, a physician must certify that patient is likely to die within 6 months. Still, there is persistent intensive care treatment at the end of life. This is due partially to the Medicare mandate of 6 months left to live. In terminal diagnosis, it's hard to predict how long a patient will have. Another reason why patients are dying in intensive care is due to nursing homes not providing hospice or palliative care. They would rather call emergency services where expensive procedures are done, increasing the patient's costs, decreasing symptomatic relief, and reducing quality of life. The third article I researched is called Early Palliative Care for Patients with Metastatic Non-Small Cell Cancer. This study was done with over 12 contributing authors and researchers. Previous studies have suggested that late referrals to palliative care are inadequate to alter the quality and delivery of care. When referred to a hospice program, patient symptoms are managed better, leading to prolonged survival rate of approximately 2 months. Early referral leads to an increased quality of life. According to much of the research presented, there are several reasons why patients are not getting the end-of-life care they need. For one, there is a lack of doctor referral and patient awareness of palliative and hospice care programs. Second, most nursing homes do not provide hospice services and therefore transfer their terminal patients to the ICU at the end of life. Third, Medicare requires patients to be diagnosed as terminal within 6 months or less with 6 months or less to live in order to provide hospice benefits. The 3 articles that I reviewed were written by professionals in their field and seem to be valid and reliable with no obvious biases. These articles were written between 2008 and 2010, which could be seen as a limitation in my review of them, due to them being published over 6 to 8 years ago. Overall, more research is required to make the much-needed improvements to end-of-life care. More patients need to be utilizing the hospice benefits that are afforded to them through Medicare to ensure that they have the best care available to them and their families during this emotional time.